I'm Dr. Nancy Elizabeth Whereatt. I've been at Dreyer Medical Advocate for 21 years. I run the Dedicated Breast Center. When I started at Dreyer, I was trained to be a general surgeon, but everyone was back then. There was no dedicated breast surgery. And as women became educated and they realized they had options, they were seeking out extra care. They didn't want to go to someone that just took care of one breast patient every now and then. In addition, breast care was becoming more super specialized in the treatment we had to offer, the diagnosis. We switched from standard mammogram to digital mammograms. We added MRIs, we added image-guided biopsies, and we needed someone that specialized in that. And women slowly but surely kept seeking me out as I really became dedicated. My first dedicated breast conference, I think, was in '93. And from then on, that became my passion. So every woman has two breasts generally. Every woman has to be in tune to breast care. Breast cancer, unfortunately, is the #1 cancer in frequency in America today. It's not, fortunately, the #1 killer because of treatment that we have to offer. Look at yourself naked in the mirror at least once a month. Any skin dimpling, nipple retraction, change in contour, anything that looks funny at all, bring it to the attention of your primary. Come in and see someone for a breast exam. My fingers have no radiation. There's very little cost here. I examine breasts every day, and really, cancer will show itself quite readily in the breast because the breast is right out here. It's not hidden deep in a cavity. Follow the radiographic imaging surveillance recommendations that we have. Your doctors know these, but basically after 40 we say yearly mammograms. Sometimes if you're higher risk we'll do it sooner. I also add MRIs with my high risk women. Basically it's coming in and making sure your breasts are checked at least once a year. If you're high risk, twice a year. Our breasts, I tell people, are more like your liver than they are like a sex object because it is a functional organ that produces milk. It changes every single month of your cycle. After having babies, after lactation, there are so many changes, and each change can potentially create a new dilemma. We are the total package. We take care of you from the moment you think there may be a problem all the way through the diagnosis, the clinical treatment, and then the follow-up. I've dedicated myself to breast diseases as well as non-malignant breast problems. I have a nurse practitioner who is dedicated to helping me screen high-risk patients as well as doing breast exams in low-risk patients. I have 2 nurses that do nothing but breast work as well. They've coordinated and navigated all the treatment that we need for breast issues, and between the 4 of us we can manage pretty much anything that has to do with the breast. Breast cancer is very, very curable. So these women will live a long, healthy life. Hopefully it will not impact on their survival, and so we have 10 to 20-year relationship with them at this point. And it's very special. We see their family, we take care of their daughters who also are at high risk if they've had, moms have had breast cancer. We have sort of a high risk center where we take care of whole families. Every day I run into a patient, not here for breast, here with their husband. On the way over here I ran into someone at Mercy. I know I took care of her probably 20 years ago. I see people everywhere and I don't forget. They're all memorable. We have some connection, almost all of us, in some way. I have patients that then go on to volunteer for American Cancer Society, that go on and help out here at the Cancer Center, that call patients, and our personal witnesses. Every day, honestly, our whole office is filled with little trinkets that people have dropped off because they remember how special it was. And once you're a survivor, it's a very unique, you see the world a different way. And I have a lot of survivors.